Hey, hello, my name's Allison. I'm a student physical therapist assistant at Cecil College. Is it okay if I record you and submit it to my teachers?
Yes.
Okay. So, the first muscle that I'm going to be talking about is the sternocleidomastoid. The origin of this muscle is the top of the manubrium and the clavicular head, the medial 1/3 of the clavicle, and then the insertion here, and then the insertion is going to be the mastoid process of the temporal bone and the lateral border of the superior neutral line of the occiput. So I would have you turn your head that way for me, and you could see it right here. So I would follow that up. Here's where it inserts at, back here. And the nerve is going to be the spinal accessory nerve, and the action of this muscle is going to be it laterally flexes the head and neck to the same side, and it rotates the head and neck to the opposite side, and then it also bilaterally flexes the head and neck, and it can assist during inhalation, like lifting the rib cage. Okay, can you pause it? Okay, so the next muscle I'm going to be doing is the trapezius. So the origin is going to be the external occipital protuberance, medial portion of the superior nuchal line, of the occiput, the ligamendum nuchae, and the spinous process of C7 to T12. So the external occipital protuberance is going to be back here. I can palpate to find that. And then the medial portion of the superior neutral line, and the spinous process of C7 to T12. So I'll follow that to here to find C7. I could ask her to put her head down more, and I could find it better. And then I would follow that all the way down. So T1, T2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So here's the origin, all of this. And then the insertion is going to be the lateral 1/3 of the clavicle, acromion, and spine of the scapula. So the spine of the scapula, I'll find right here. I could ask her to put her arm behind her back, like this, so I could feel her scapula better. Okay, you can put it back. And then, so spine of the scapula, and then the lateral 1/3 of the clavicle in the front, and then so that's the origin of insertion. And then so the action of this muscle is going to be the upper fibers bilaterally extend the head and neck, and the upper fibers are going to laterally flex the head and neck to the opposite side, and then it also elevates the scapula and upwardly rotates the scapula. And then the nerve is the spinal accessory nerve. Spinal portion of cranial nerve, accessory nerve, and ventral ramus, C2, 3, and 4. Okay, so the next muscle I'm going to be showing is the anterior scalene. So the origin of this is going to be the transverse process of the 3rd through 6th cervical vertebrae. So I can come back here, find her C7, and then go up. That'll be C6, and then up. 5, 4, 3 will be C3. And you come around anteriorly. So the origin will be anterior, and then the insertion is going to be the first rib. So I could find her clavicle, and from there I could find the first rib right here. And then the action of this is going to be it unilaterally, with the first rib fixed, is going to laterally flex the head and neck to the same side and rotate the head and neck to the opposite side. It bilaterally elevates the rib cage during inhalation, and it also flexes the head and neck. And then the nerve is going to be C3 through C, and then C4 through 8. So the next muscle is going to be the middle scalene, and the origin is going to be the transverse process of the 2nd through 7th cervical vertebrae on the posterior tubercles. So I can go to C7 again, find that, and then it is 6, 5, 4, 3, 2, C7 to C2, and then I'll bring my fingers around so you can see that. And then the insertion is going to be the first rib again, right here. And then, so the action of this muscle is going to be unilaterally, with the ribs fixed, it laterally flexes the head and neck to the same side, rotates head and neck to the opposite side, and then bilaterally it will elevate the ribs during inhalation. And again, the nerve is going to be C3 and 4 through 8. Okay, the next muscle I'm going to show you guys is going to be the posterior scalene. So this is the origin is going to be the transverse process of cervical vertebrae, the 6th and 7th. So again, I will come back here, find C7, and then go up, and that will be C6. And I can come around again to show you guys where. And then the insertion is going to be the 2nd rib. So where I found the 1st rib before, it'll be down, and it'll be the 2nd one. And then the action of this muscle is going to be unilaterally with the ribs fixed. It laterally flexes the head and neck to the same side, and it rotates the head and neck to the opposite side. And then the nerve for this one is going to be C3 and 4 through 8 again. Okay, so the next muscle I'm going to show is the transverse abdominis. The origin is going to be the lateral inguinal ligament, the iliac crest, and the internal surface of the lower 6 ribs. So to find this, I will find the iliac crest. So I'll put my hand right here. I can feel the iliac crest, and then turn a little bit towards it. And then I can go up and find her ribs, and then the internal surface of the lower 6 ribs. So here, 2. So there I'm palpating. And then the insertion is going to be the rectus sheath to linea alba. So to find this, I could again go to the iliac crest, come in, and somewhat find the belly button, and it's going to be right through here. And then the action of this is going to be to compress the abdominals. And the nerve is going to be T7 to 12, L1, iliohypogastric, and ilioinguinal, the ventral divisions. Okay, so the next muscle is going to be the rectus abdominis. The origin of this is going to be the pubic crest and pubic symphysis. Insertion is going to be the cartilage of the 5th, 6th, and 7th ribs, and the xiphoid process. So you can find the ribs, fifth, 6th, and 7th rib, the cartilage. And then the action of this muscle is going to be, it flexes the vertebral column and tilts the pelvis posteriorly. The nerves are going to be T5, 6, T7 to 11, and T12, and the ventral rami. Okay, so the next muscle I'm going to be doing is the spinalis. So the origin of this muscle is going to be the spinous process of the lower thoracic and upper lumbar vertebrae. So I can find C7. Can you look down? So upper thoracic, no, lower thoracic. Okay, you can look back up. Okay, so lower thoracic, then the upper lumbar, and then so this here be the origin, and then the insertion is going to be the upper thoracic vertebrae. So again, find C7. Can you look down? Yep, C7. This would be the upper thoracic. And the action of this the action of this muscle is going to be to unilaterally flex the vertebral column to the same side and bilaterally extend the vertebral column. And then the nerve is going to be your spinal nerve. So the next muscle is going to be the long isthmus. And this origin is the common tendon thoracis, transverse process of upper 5 thoracic vertebrae, cervicus and capitis. So in order to find this, transverse process of upper 5 thoracic vertebrae. So can you look down? Upper 5, so C7. 1, C2, C3. The transverse process, I can roll my fingers to be sure that I'm on this. You can look up. Thoracic vertebrae. And then the insertion is going to be the lower 9 ribs, the transverse process of the thoracic vertebrae, thoracis, transverse process of cervical vertebrae, cervicus, and massoid process of temporal bone. So the insertion, lower 9 ribs. So